All right, guys, so this lesson we're going to talk about therapeutic communication in the medical office, and that is in regards to talking with your patients, interacting with other staff members, and just having that empathetic ear for everybody involved. So some of the things that we're going to cover today is obviously the vocab, as we do every section. We're going to go through, be able to define, spell, and pronounce those terms. We're going to talk about first impressions. We'll be able to do the following tasks and skills related to communication. We need to be able to identify styles and types of verbal communication, identify types of nonverbal communication, and recognize and respond to verbal and nonverbal communication. We also need to be able to recognize communication barriers. We'll summarize factors that should be considered when communicating with diverse patient populations. We will identify techniques for overcoming communication barriers, and we'll have to be able to do the following related to communication during difficult times, and that's recognizing the elements of oral communication using the sender-receiver process, apply feedback techniques, including reflection, restatement, clarification, and to obtain information, and then discuss open and closed questions or statements. And finally, we need to be able to discuss important factors about therapeutic communication across the lifespan, and then we'll talk about Maslow's hierarchy of needs. So the first thing we're going to talk about is first impressions. And, I just want you guys to think for a second of why you think first impressions are so important. But they're really important because the opinions formed in the early moments of meeting someone remain in their thoughts after the first words have already been spoken. So you guys are the face of the medical office. You guys sit in the front, and you are the first person that they see when they come into your office. So if you make a positive first impression, they're going to have a positive first impression of your medical office. Therefore, they'll want to come back. They'll want to refer other patients to you. So therefore, you're making money. If you have a negative first impression, it might set the tone for the entire visit, and that might be a little bit more difficult for you guys from there. First impressions also consider physical dress and appearance. Excuse me, I'm a little sick. Your positive attitude, being able to show compassion, always having that smile on your face, and being able to communicate effectively. So whenever you interact with a patient, always address them by name if it's possible, because delivering patient quality care is the primary objective as us. That's what we want to do. We want to deliver excellent primary care. You need to be aware of your personal life. Be aware of the personal life of the patient. It will show him or her that you care about enough to ask. If you need to build a rapport with every patient. Just ask them how they're doing. How are the kids? How is the husband? Or something along those lines. Their personal life events that happen with them directly affect their health. So, having a good knowledge about their personal life and what they really do outside of that medical office is important as well. Staff members in the facility are in familiar surroundings and already have some information about the patient. However, the patient knows absolutely nothing about the staff members, so it's important to be able to relate to them. Healthcare professionals accept the responsibility of developing helping relationships with their patients. All right, so this all has to do with first impressions. You guys want to make the best first impression that you can so that they feel comfortable enough with you to share all this information with you, and then you can really provide that optimal patient care. And we'll continue on with patient-centered care. So basically, patient-centered care is an innovative approach to the planning, delivery, and evaluation of healthcare. And it's grounded in mutually beneficial partnerships among healthcare providers, patients, and families. All right, each patient has a unique set of needs. So you need to treat each patient as an individual. And having good communication skills so you can relate to that patient is vital. So this applies to patients of all ages and may be practiced in any healthcare setting. So if you can really grasp therapeutic communication, you're going to be a prime employee. They're really going to need you in that facility and in that position. So all healthcare professionals have embraced this patient-centered care where you really focus on patients' needs individually. And being able to focus on those patient needs comes with some skills, okay? And those are the verbal and nonverbal communication skills. Now, verbal uses words and sounds, okay? That's how we communicate with verbal communication. Nonverbal communication is you can check and look into body language, gestures, mannerisms, eye contact, facial expressions, posture, touch, all the other things. So body language is partly instinctive, partly taught, and partly imitative. Okay, we kind of pick body language up naturally, but we also get some things from our surroundings as well. So why is it so important to be able to properly interpret nonverbal communication? And that's because our ability to help others increases as we hone in on our own skills in interpreting nonverbal communication. It is always more accurate than verbal communication and tends to convey our true feelings and belief. Okay, you can talk a great game, you might have great verbal communication skills, but if your body language is slacking or your other nonverbal communication avenues is slacking, your true feelings about how you feel about a situation can show through. So you really need to, when you're communicating with somebody, use positive verbal communication as well as positive nonverbal communication. And that nonverbal communication probably plays more of an important role in successful communication. So let's look at verbal communication a little bit more in depth. So verbal communication can involve many different components, such as words and sounds, like it says here, pitch, the highness and lowness of their voice, their tone of voice, how they're saying words, and their word choice are all important in verbal communication. Now, verbal communication can be written or it can be done orally. All right, and we'll talk about some different types of verbal communications here in a little bit. Always enunciate your words, and by enunciating, you are speaking professionally, you're speaking clearly, and you're putting proper emphasis on different parts of the words. So always be sure that the patient can hear you, speak loudly and clearly, enunciate. This is especially important when the patient wears assisted hearing devices. They might not be able to hear you as well as they should be able to. Avoid using sarcasm or caustic remarks. Always have eye contact, that is critical, and always be professional. All right, always be professional. Use gestures when appropriate to liven the speech and animate the conversation. Patients expect professionalism, and they have the right to demand that as well. So, like I said at the beginning here, it says verbal communication can be oral or written. We all know oral verbal communication, but what about written communication? Written verbal communication, what is that? All right, now that could be anything from pamphlets, to handouts, to provider emails, provider orders, emails, faxes, text messages, handwritten notes. Those are all types of verbal oral communication, or verbal written communication, I'm sorry. Now, electronic communication is efficient, but you have to use that with caution. Patient confidentiality is huge, and that's what we really need to focus on. It is making sure that we protect that. And you must ensure that the patient is receiving the information. All right, it's not like you're delivering it by hand; you're delivering it electronically. So you have to make sure that they actually receive that information. Don't use abbreviations in text messages. Write things out, write everything out, so that there's no confusion there, and everybody is on the same page. And never use all caps in text messages or emails. Why, you may ask? Well, if you write something in caps, they might think you're like screaming at them or yelling at them through these emails. So use professional lingo. Use professional. Don't use professional abbreviations, and professional writing skills, guys. That's what we really need to focus on. So nonverbal communication. Now, this is a big one. This is where we need to really focus on here. So what is involved with body language? It can be anything from eye contact to facial expressions, hand gestures, grooming, how well you take care of yourself, how you dress, your space you give them, your tone of voice, your posture, your touch, and there's much more that goes into that. Okay? You can look at gestures and mannerisms, all right? However, appearance is huge in that. Okay? Appearance is an integral part of nonverbal communication. Our appearance influences the ways others view us and can present a conflicting message or have a totally incorrect message if it's not the part. So you need to dress professionally and up to standards of your practice. The successful medical assistant expresses self-esteem and confidence by stance, by their vocabulary, by their facial expressions, and by a caring attitude, really caring for that patient. Facial expressions can often convey the true feelings if they're not masked by the words we use. Our eyes often tell the truth when our words are misleading or false. So verbal and nonverbal communication have to be in congruence. Okay? You have to be able to speak well, but also show positive and professional nonverbal communication as well. So if you look on page 43 in the textbook, you're going to see a box up there, a procedure box for how to respond to nonverbal communication. Just look over that, see what it is, and learn a little bit from that. And this is also in your book. It's on page, I never wrote it here, hold on. Page 44 at the top there, table 4.1. And you can look over that. it says observations of nonverbal communication to patients. Now these are some of the things that you can notice and observe from patients. You can observe their breathing patterns or their eye patterns, okay, their hands, their arm placement, their leg placement. You can kind of read into all this. So for example, if you look at their breathing patterns and you see rapid respirations, they're sighing, they're taking shallow thoracic breathing like that, it could mean they're having anxiety. It could mean they're bored or in pain. All right, their eye patterns. If they move side to side or they're looking down at their hands, okay, read their eyes. It might show you that there's anxiety or distrust or even embarrassment there. So look through that chart on page 44 and just get some more, educate yourself a little bit about it. So being able to recognize and respond to verbal and nonverbal communication. So nonverbal signs are critical to patient care. Being able to read their body language is key. So careful observation of the patient as a whole is worth the time investment and may even save the patient's life. So you need to keep eye contact and look for signs of trouble. If they're crying, just ask why. What's going on? Why are you crying? Don't allow an emotionally unstable patient to be left alone. Right? If they're if they're really struggling in there, don't leave them alone. Be there to offer support and ask what you can do for help. However, do not allow I already said that. So then you need to reassure patients of safety. Let them know that they're safe here, and that they can be, you can talk and let me know what's going on and go from there. And be aware of abnormal behaviors. Okay, know the patient, and if it seems out of the ordinary, let the doctor know. And always use that correct documentation. Observations that you make must not be mistaken for diagnosis. So you don't diagnose people, just observe and see their body language, and it all help play in to come up with a diagnosis down the road. Now there's going to be some things that get in the way of communicating, and those are communication barriers. So effective communication requires the delivery of a clear message to the patient. You deliver the message clearly, and then they interpret it clearly. Communication barriers can arise from both medical assistants and patients. Okay, it just depends on the situation. And there are many communication barriers can cause misunderstanding and misinterpretation of your message. So you want to try to eliminate these communication barriers or overcome them. So we're going to get into this a little bit here. Providing unwanted assurance. Okay, this could be communication barriers. Instead of providing unwanted assurance, use a reflective response. Okay, let them know that. Giving advice can be a communication barrier. So encourage further discussion with the provider. Don't give advice, just encourage them to talk to the provider. Using medical terminology can be a communication barrier. So you need to adjust the vocabulary to fit the patient. All right, if you have you're working in a pediatric clinic and you have an 8-year-old coming in and you start talking in medical jargon, the 8-year-old's not going to understand what's going on. So really fit your vocabulary to fit adjust your vocabulary to fit the patient. And leading questions, and by leading questions I mean something like, "You don't smoke, do you?" Okay, that's a leading question, and that implies disapproval. So what you could use instead could be, "Have you ever smoked, or do you use tobacco?" Okay, and that is more of a appropriate question. Talking too much. Okay, that could be a communication barrier. As a medical assistant, you should always listen more than you talk. Okay, listen to the patient and understand what they're saying. Stereotyping. Okay, and that is preconceived notions that you really need to push aside and not let get in the way. They might have a physical impairment, or you might have a physical impairment, and you need to adjust as appropriate. Okay, and then there could be a language barrier, and that's really hard. You just need to confirm understanding. So by being sensitive to problems, the medical assistant can use therapeutic communication techniques to help their patients. You need to be sympathetic to diversity. Okay, you need to have empathy. Empathy is the key in creating a caring therapeutic environment. So many different factors influence the development of a value system, and you need to be able to recognize your own value system. So they begin as learned beliefs and behaviors. Family and cultural influences will help shape the way that we respond to a diverse society. Okay, so if you look on page 46 in the textbook, okay, at the bottom of 46, it's kind of cut off into 2 pages there. There's a sensitivity to diversity box. Really look at that. It's a great thing because this gets into like different cultural backgrounds and explains some of the differences. For example, it says patients of Asian backgrounds may have been raised in a culture that considers it extremely rude to establish eye contact. Americans, however, view an unwillingness to establish eye contact as a sign of distrust or embarrassment. However, for individuals from Japan or China, lack of eye contact may be a way of demonstrating respect. So you really have to understand different types of cultures and their values. So overcoming barriers to communication. And these are the steps that you need to take. So treat every person as an individual. Okay? It's patient-centered care. Every patient is different. You need to treat them as individuals. Understand all points of view. Okay? You might have your opinions, but you need to set your opinions aside and not be biased, and understand all points of views. With non-English speaking patients, the medical assistant may need to use gestures and more body language to convey the message, just to help them understand that. Discuss calmly and then respect others' opinions, guys. That's a little bit of common sense there, to be honest with you. So communication during difficult times. Now, you will be faced with these. You will face difficult times. The patient might come in and they're in need and in dire need of somebody to talk to, or in need of medical attention. That's a difficult time. Maybe they got some bad news from the doctor, and they're going through that difficult time. So you always need to remain calm, have a lot of patience with them, and determine the best way to help the patient out of any immediate danger. And the key to all of this is just to listen to them. Let them get out their voice. Okay? Communication is not an art that comes easily to everyone. All right? So it does take practice, it does take experience, and you will gain these skills throughout this class and throughout your career. So here's a couple different therapeutic techniques with communication. So linear communication model describes communication as an interactive process. It involves a sender, a receiver, and feedback. So the sender is a person who sends the message through a variety of channels. Maybe it's through speech and verbal communication, there's nonverbal communication. Okay, the sender then receives that message, and then they try to encode it and try to figure out what it means. The sender sends the message and encodes it in the way they talk with their verbal and nonverbal communication. The receiver then receives that message, and then they have to decode what exactly they were trying to say according to their understanding of what is being communicated. Okay? And then they give feedback from the patient, to let them know what they understood. The verbal messages you send are only part of the communication process. Okay? And that communication process we just went into, saying it is just a small portion of it. So here's some active listening techniques. Active listening goes far beyond just hearing what is said. It goes to concentrating, understanding, and then giving feedback and reflecting on that. Okay, so hearing is the process, function, and power of perceiving sound. Listening is paying attention to sound or hearing something with a thoughtful intention. So listening is not a passive role. You can't just sit there and listen. You have to sit there and interpret and take it in and understand these things. So there are basically three processes involved, and that's reflection, restatement, and clarification. Now, if you look on page, let me see here, 48, okay, in procedure 4.2, it works with applying feedback techniques, including reflection, restatement, clarification to obtain patient information. This would be a good one to look over, and just to further your understanding of how to use those active listening techniques. Let's talk about open and closed questions or statements now. Open questions are asked for general information. Okay? Use this to begin a conversation with the patient or to introduce a new section of questions. Closed questions ask for a specific information. So usually the answer is limited to like a yes or a no answer, and use these when you need confirmation of specific facts. So if you need to find out what kind of insurance the patient has, what do you think you would use? Would you use an open or a closed statement or question? And the correct answer is going to be a closed statement because you need to know the specific information, the specific facts. So for example, what's the name of your insurance carrier? That's a closed answer. They're just going to give you one short answer. They're not asking you how you're feeling today because that's more of an open-ended question where they can talk and back and continue that conversation a little bit further. So communication varies across a lifespan, from pediatrics to geriatrics and everything in between. So you need to use an age-specific approach. So how can you help school-age children gain a sense of control at their appointments? Let them choose the site of the injection, or if they're old enough, ask them if they want a caregiver present. Okay, give them some control. Let them talk to them in their things, at their age-specific level. Make sure the environment is safe and attractive for all ages. All right? Always provide privacy for older children, even adolescents. And don't keep children and their caregivers waiting any longer than necessary. Do not offer them a choice of the child unless they can truly make one. And then listen to the parents' concerns and coach the patients based on the cultural diversity, their developmental age, and their communication style. So therapeutic communication is extremely important when interacting with adult patients. So now we're going to talk about Maslow's hierarchy of needs. And there's 5 needs, and it's in a pyramid, which I'll show you next slide here. But basically the needs are psychological needs, which are those that affect our physical well-being, such as food, water, and sleep. We need those things. Then there's safety and security. We all need to feel safe in our environments, whether it's in the clinic, at home. We just need to feel safe. We need to feel love and belonging. We need love and belonging. Everyone wants to feel loved and accepted by those around us. We all need esteem and recognition. We have an inner need to feel good about ourselves and to know that others view us in a positive manner. And that starts with making that good first impression, having that good positive first impression. And then we need self-actualization. We must all maximize our potential and really reach for the stars. And here is just that Maslow's hierarchy of needs. Okay, you can see psychological, breathing, food, water, sex, sleep, homeostasis, excretion, those types of things. The safety, security of body, of employment, of resources, of morality, and a family, of health, property, love and belonging. You need to have friendships, family, and sexual intimacy. Esteem, you need to have self-esteem, confidence, achievement, respect from others, and respect by others. And then self-actualization, morality, creativity, spontaneity, problem-solving, lack of prejudice, acceptance of facts. Those are Maslow's hierarchy of needs. So we're going to close up this presentation going over a little bit of patient education and legal and ethical issues like we do in every slideshow. So the medical assistant with good communication skills can assist the patient in understanding the role in their own care. So being able to provide education to parents in a variety of formats. Always explain the literature given, ask the patients if they have any questions or to repeat the instructions back, and recognize emotional needs. Always ask questions. So ask questions to remain aware of what the patient is communicating and what is not being said. So keep them educated, guys. Let them know with good communication skills. And then legal and ethical issues here to close up. So all communication with the patient must be professional and accurate. Never give advice unless approved by the physician first. It is not our job. We are medical administrative assistants. We don't give advice. Always discuss patient care issues with the physician. If you have any concerns or questions, patient shows up and they're hysterical and not feeling well, relay those concerns to the patient. Never agree to withhold information from the physician. You need to let the physician know so that they can give the best patient-centered care possible. And then, of course, use excellent documentation skills. Documentation, guys, is key in this career field. You have to be able to document everything properly. And then remember that an open, trusting relationship with a patient helps prevent legal issues in the future. So establishing that at the first visit, guys, really goes a long way to patient satisfaction and the way you treat your customers. So that is it for this section, guys. If you have any questions, feel free to ask me in the class. I'm here for a reason. If not, have fun with the assignment. Good luck and keep working hard.